welcome back to my channel. First, thank you to all those who watch my videos and subscribe to my channel. So this week's vlog is about my week 30 pregnancy update, and that includes my labor and delivery visit last Thursday, and I'll tell you the story in a bit. Earlier this morning I had my OB/GYN visit and everything went well. So this week my baby is about a size of a summer cantaloupe, about 17 inches long and about 3.5 pounds in weight. And from this week she'll start to pack half a pound every week until she's born. Whoa, that's exciting. I can't believe I'm almost there, because 9 more weeks and I'll see her already. I'll meet her in person. Yes, 9 weeks, because I'll be induced early due to my gestational diabetes. So anyway, this week most babies start to move their position from breech or transverse to a head down position, which is the safest position for delivery. And for this week, common signs and symptoms is that increased in tiredness, difficulty sleeping, and mood swings. Yes, mood swings. We thought that it's only common during a first trimester, but no. Also in third trimester, it's very common because of our increasing hormones, especially the hormones that relaxes our muscle to get us ready for delivery. For me, this week's symptoms is that difficulty sleeping is increasing so much. So I go to the bathroom like 3-4 times every night, and sometimes it takes me 2 to 3 hours before going back to sleep. I know it's so bad, but it's okay. It happens. Also, last Saturday I had a leg cramp for the first time with this pregnancy. So it's on my right calf. It's so painful. I was like, it woke me up. I was like shouting, calling my husband for help to help me relax my my leg, because it's really painful. So yeah, he woke up and helped me, and then I felt relief. But then after a few seconds I had a second cramp on the same leg, and it's much painful. And that time I was already crying because it's really painful. And I touched my calf and it's so hard. And then it's really bad that it made my right calf very sore for 3 days. I was like limping. But thank God it's better now, because it made me nervous. I'm like, it never happened to me before with my first pregnancy that yes, I had some cramps before in my first pregnancy, but it never happened that it stays sore for a couple of days. So I asked Dr. Google, and I read there that if you had a severe cramp or leg cramp, it may take it will be sore for a couple of days. And I've read some forums too that says that they've experienced the same thing, and I'm glad that I'm not the only one, because it scares me. But anyway, aside from that, last week Thursday I was sent to labor and delivery. It's because of my severe abdominal pain on the left side. It was constant already for 2 days, and so happened that my OB case manager called me and have advised me to go there already to check everything and to make sure everything is all right. So I went there. They hooked me up to the monitor to check for my baby's heart rate and for contractions. But gladly, everything is all right. So Dr. Wen, one of the doctors there, came in and explained to me that yes, it's those kinds of pain are normal during the pregnancy, especially when our uterus is becoming big, or because the baby is getting bigger. So they said it's a ligament pain. At first it didn't came into my mind that it's a ligament pain or a round ligament pain, because I thought ligaments or round ligaments is only around the pelvic area, but no. So they said ligaments are from here going down to the groin. So yeah, because my pain was right here. And it's really painful. It's so difficult for me to move, especially when I'm driving and it's a bumpy road. It's like a torture, really. I'm not trying to overact about it, but it's really painful. And then so yeah, they explained that to me, and they advised that I can take Tylenol if it's too painful for me to handle, but I refuse to take medication. I'm just gonna bear. I'm just gonna deal with it. Also, they said to just move slowly and avoid any sudden movements, because it's gonna worsen the pain. Because it feels it feels like sharp, dull. It's like pulling and stretching pain. Even walking is so hard to do with that kind of pain, but I'm glad right now it's a lot better. So I'm just thankful. But I still feel some pain sometimes, but since I know that it's normal, I'm just gonna like deal with it. So yeah, that's the story about my labor and delivery. I'm glad it was just like that, and I was sent after like 45 minutes. I was sent home after 45 minutes. And then also, as I've mentioned on my last vlog, that I'll show you how I administer my insulin and how I check my sugar. So before I show you the video, because I made the video this morning to show you how I actually administer it, because I only administer my insulin in the morning, before breakfast, before dinner, and at bedtime. And in that way, I can actually administer it to myself. So I'm using two kinds of insulin, and that is the Humalog, the rapid acting insulin, and the NPH, or the intermediate long acting insulin. So those two, I have to mix them in the morning. And so for the injection site, we can inject it on the back of the arm, on the abdomen, on the lower abdomen, and at the back, lower back, on the fatty tissues. And then you can also put it or inject it on the thighs. So always remember to wash your hands before doing it, and clean the site with alcohol wipes. So after cleaning it, we have to dry it before injecting the insulin. So the way it works is that you have to pinch the site, the fatty tissue, and then inject the syringe. And then after you have to inject the insulin slowly, and then once everything is injected or administered, you still pinch it. Don't release it for about 3 seconds, and then after 3 seconds, remove the syringe, unpinch it, and that's it. It's so easy. And don't forget to discard the syringe on the proper container, like a sharps container or any colored container. Okay, so guys, now that I've explained to you how I check my insulin, in a little bit I'll show you how I administer it to myself, and also I'll show you how I check my blood sugars every time, because I have to do it 4 times a day, and that is in the for fasting, when I wake up, after breakfast, after lunch, after dinner. That's 4 times. So make sure that you only use these fingers. Do not use the thumbs. All right. So I believe they don't want you to use it, because there's more capillaries on it, and it will bleed more and it hurts more. And then also do not use the top part or the tip of your finger, just the sides. So what you can do is just put your fingers on a flat surface, and anything that doesn't touches the surface, so that's the site where you can prick your finger to check your sugar. So when you prick your finger, discard the first drop of blood, because it might contain any bacteria or chemicals from the alcohol that you used. And also, I forgot to mention to wipe the site first with alcohol if you did not wash your hands. So now that I've explained it to you, I'm gonna go ahead and show you the video. So this is my wallet. No, this is not a wallet. This is where my glucometer is and everything that I need to use it. So when I open it, it looks like this. So this is my meter. This is I don't know what it calls, but the needle is inside it, and it has the numbers here. So the higher the number, the more it hurts, because the longer the needles, it will poke your skin. So usually I just put it number 2, and I'm using a 30 gauge fine needle, so it doesn't really hurt that much. And then I have my strip. My machine is called One Touch VarioFlex. Hi baby, good morning. And then good morning, Kisami. So this one, it's really good because it has an app that you can download on the phone, and you can sync the result because it's Bluetooth capable. And then good thing about it is my healthcare team can remotely see the results too, of course with my permission. So I already washed my hands earlier, but still I always want to use alcohol wipes to inject the site. I'm gonna get a little bit of cotton to wipe the first drop of blood and use the second one. Okay, so first I'm gonna put a needle in here.
But why?
Yeah, we have to change it every time we use it, so to make sure it's clean.
Oh.
Yes, that's right. And then I'll get an alcohol wipes.
What have the whole wipe? Last morning I smell it.
Yeah, you smell it. So make sure to just do not use your thumb, and just prick the sides of your fingers. So me, I'll use this finger and wipe it with alcohol and let it dry. Then I'll put in my strip.
Where's your whip go?
The strip is here, baby. And
What
then
does that do?
it reads my blood sugar. So now that it's dry, I'm gonna prick myself here.
No, don't poke yourself.
It's okay, baby. 1, 2, 3. There you go. So there, got
You
some
have
blood.
The blood.
And then I'm gonna wipe it.
There you go.
And then there's the second drop of blood that I'm gonna put here in the strip. And now you'll see it reading. Okay, so my blood sugar, my fasting blood sugar is 80, and so I met my threshold because my blood sugar has to be between 130 and 70.
You say goodbye, everybody.
Good.
Say for my video, goodbye.
Goodbye, everybody. I'll see you in a bit.
And goodbye, everybody. You subscribe this video. This subscribe.
Oh yes, please subscribe on my video. Thank you, baby.
Say goodbye.
Goodbye. And oh, the needle, since we have to always change it, don't forget to discard it in the sharps container. So now that I'm done checking my fasting sugar, now I will administer insulin to myself so I can already eat breakfast. So yeah, this is where I put everything: my alcohol wipes, my insulin, and my syringes. So since
Doritos.
yes, earlier I washed my hands already. I have my sharps container here. And you don't necessarily have to use this. You can use like those containers that are colored. Like if you have like a Tide or a Downy container, you can use those. Here's my NPH and my Humalog. So this is the long-acting insulin. I make sure to put the date. NPH is good for 31 days after opening in room temperature. This is the Humalog. The Humalog is good for 28 days after opening in room temperature. So make sure that you put the expiration date or the date that you open it, so you know when to discard it. So even if it's not empty yet, but if it's already due or expired, you have to throw it away because the potency is no longer good. So okay, this NPH, as I've mentioned earlier, has a solution that has to be mixed together, and we have to roll it in our palm, between our palms at least 10 times. Alright, and this is my Humalog, the rapid acting insulin. So this one is clear. So as I've mentioned earlier, when drawing insulin, you have to draw clear before cloudy, which is clear before cloudy. But when injecting air, you have to inject first on the cloudy. Don't forget to always wipe the top of the vial to make sure there's no bacteria. I'll just put it here. So since I need 20 units in the morning, I need 20 units of Humulin or NPH. I'll draw 20 units of air. So that's 20 units. Anna, hello. So just stay there, okay? Because Mommy has a syringe here.
Mommy, I'm behind you.
Okay. Say hi.
Hi.
All right. So
Hi,
you always have to draw the amount of air that you will draw is the amount of insulin that you need. So I have 20. I'll open it now and inject the air to my NPH. And then for the Humalog, I need 6 units.
Super cold.
And guys, after administering insulin to yourself, make sure to like especially Humalog, you have to eat within 5 minutes because it's rapid acting and we don't want it to go low blood sugar. Okay, so now I'm drawing insulin to the Humalog, which is the clear. I'm gonna get 6 units. Okay, let me put it back. So the trick that I've learned here is to draw fast to get insulin more than what I need, and then just push it back to prevent bubbles.
Mommy.
There you go. So there's no bubbles. I got 6 units. And then now I'm gonna draw NPH of 20 units.
Mommy, I want.
So 6 plus 20 is 26. So I have to make sure I have something here. I have 26 units here in total. This one, make sure you don't push back because we cannot mix them together unless the potency will change. So okay, I'm gonna draw 20, 22, 24, 26. Okay, there you go. So now that I've drawn it, usually I'll do that and then I'll clean the side. So my preferred side is the abdomen because I haven't tried it in my arm or in my thighs. And I use my lower back too for the insulin administration, but that's when my husband is here to help me. So okay, So now I'll show you how I administer it to myself. Alright, so now I'm ready to administer the insulin to myself. And I chose this side here because I feel like it's less painful whenever I administer it on this side. So I have a lot of stretch mark, and so it's harder for me to find a site for injection, but it's okay. So I'm gonna wipe it with alcohol in a circular motion, and then I'll just like put it here under the site. So I have a landmark, and then I'm gonna get my insulin. I'll let it dry first, and then when it sits dry, I'll administer it. Okay, there you go. Now that it's there, I'm gonna go ahead and inject it slowly. Okay. It has to be slowly because sometimes when it's fast, it turns to burn and like it feels burning inside. There you go. So I'm still pinching it. Oh, I forgot that you have to pinch the side before you inject it. So to make sure that you're grabbing the fat, and then or the fatty tissue, and then after you inject everything, you have to pinch it at least for 3 seconds, and then take it out and unpinch it for about 3 seconds before removing the syringe. So there you go, I'm done. And then now I'm gonna discard it to my sharps container to make sure it's in a safe place. Please bear with my stretch marks. Alright, so this is my 30-week belly. Thank you for watching my video. If you guys have any comments, suggestion, or any feedback, please let me know on the comment box below. And if you like my video, please give me a thumbs up and subscribe to my channel for more updates. Thank you.